My name is Rachel Garrett. I'm a physio at the Children's Trust. The Children's Trust is a rehabilitation centre in Surrey. We look after children with really complex needs following brain injuries. These needs can range from physical, sensory, cognitive, lots of different challenges. Some of our young people will be in wheelchairs, some will be walking, some of them can't talk, some of them can't eat. And the ceiling track hoist by Guldmann allows us to start rehab really early. So some of the young people that we use it with, they might not be functionally standing and stepping, but they've got activity in their lower limbs or their trunk, that the de-weighting system, particularly on that trainer mode, allows them to actively use that movement within a stand or within stepping, and they're completely safe. It's fantastic that it reduces the load on us, so we might need less people. It might be that to stand without it you might need 4 people, someone on either side, someone at knees, someone at the back, and actually with the trainer mode you can do that with 2 people. Also, it's less effortful for the young person. They feel safe. So many of our young people, their knees might give way. The hoist has completely got them. It allows us to do more repetitions because we're not tiring and the young person's not tiring as much. We've got XY tracking with it, so we can move around the gym rather than on a single track. It gives them that freedom of movement. It has the ability to lock, so that if you don't want as much freedom of movement, you can also gain that for those sit-to-stand moments. But it also allows getting on and off the floor. We can train a real functional movement that would normally be very effortful for the young person, sometimes quite uncomfortable, and very, very heavy on us. We're really lucky to have one in our gym environment, so we can do early work on the plinth or in standing, but we've also got a long stretch in the corridor, so we can do that stand and a long continuous walk, but also we have used it for things like bike riding, where normally there'd be 4 of us around this child, very scared that they might come off, but actually the hoist has given us that ability to do that and feel safe. And in rehab we take a lot of risks, and the hoist allows us maybe to take that risk a little bit earlier because we know we're safe. We're safe for them, but also safe for us. So it's a whole range of different reasons why we might use it, and can go from the really early days actually to our higher level skills.